I want to talk to you today about the blood pressure medications that a great many of you take every single day, often for years, frequently without anyone ever explaining how they work, what to watch for, or the simple things that make them safer and more effective. The common ones like Amlodipine, Losartan, Lisinopril, and the water tablets, and what every senior taking them ought to understand, because millions of older adults take these medications, and they're genuinely among the most valuable and life-protecting medications in existence. Yet people often take them with little understanding, sometimes worried by things they needn't worry about, and unaware of simple points that matter. So understanding your blood pressure medications accurately and calmly is genuinely worthwhile. So today I want to explain why these medications matter so much, roughly how the main types work, the common and manageable side effects, the crucial rules that keep you safe, the things genuinely worth mentioning to your doctor, and the single most important message about never stopping them on your own in partnership with your doctor. And I'll keep this calm, accurate, and empowering because understanding your medications helps you take them well and safely, while the golden rule, never change them without your doctor, protects you in partnership with your doctor and pharmacist. This is about understanding the medications that quietly protect you so you take them well, and nothing here is a reason to change anything on your own. Let me start with why these medications matter so much, because it frames everything. Let me start with why these medications are worth taking and understanding. High blood pressure, as I've discussed, is a major, usually silent risk factor for heart attacks, strokes, heart failure, kidney problems, and more, quietly straining your heart and arteries for years without symptoms. Blood pressure medications lower that pressure and, in doing so, genuinely reduce your risk of these serious events, which is why they're among the most valuable medications there are and why taking them faithfully matters. The fact that they work silently, you don't feel them working, is precisely why some people undervalue them or forget them, but the protection is real and important. So these medications matter enormously because they lower the silent, serious risk of high blood pressure, genuinely reducing heart attacks, strokes, and more, even though you don't feel them working. So understanding that these medications provide real, silent protection is the foundation. So blood pressure medications silently protect against serious events. So they're valuable and worth taking faithfully. Let me explain roughly how the main types work, because understanding demystifies them. Let me explain, in simple terms, roughly how the common types work, since understanding them helps. Amlodipine belongs to the calcium channel blockers, which relax and widen your blood vessels, so blood flows more easily and pressure falls. A common, harmless, but sometimes bothersome effect of this widening is ankle swelling, which I'll return to. Lisinopril is an ACE inhibitor, and Losartan is an ARB. Both act on a hormone system that controls blood pressure, relaxing vessels and reducing fluid retention, and they also protect the heart and kidneys, which is why they're often chosen. The ACE inhibitors like lisinopril can cause a characteristic dry cough in some people, which I've discussed. The water tablets, diuretics, help your body clear excess salt and fluid, reducing the volume the heart handles and lowering pressure. So the common medications work in different but complementary ways to lower pressure and protect you, and are often combined for that reason. So amlodipine widens vessels, lisinopril and losartan act on a blood pressure hormone system while protecting heart and kidneys, and water tablets clear excess fluid, working in complementary ways, often combined. So understanding roughly how each works demystifies them. So the main types lower pressure in complementary ways, so they work differently but toward the same protective goal. Let me explain the common manageable side effects, because knowing them prevents needless worry and needless stopping. Let me talk about side effects honestly, because understanding them prevents both needless worry and the dangerous mistake of stopping medication over something manageable. Amlodipine commonly causes ankle swelling from the vessel widening, which is usually harmless though sometimes bothersome, and worth mentioning to your doctor, who may adjust things, but note that this swelling is different from the swelling of heart failure I've discussed, which is why your doctor should assess it rather than you assuming. ACE inhibitors like Lisinopril can cause a dry, tickly cough, which is harmless but annoying, and if it bothers you, your doctor can often switch you to an ARB like Losartan, which usually doesn't cause it. Any blood pressure medication can sometimes lower your pressure too much, causing dizziness, lightheadedness, or feeling faint, especially on standing, which matters because of falls and warrants mentioning, and each has its own less common effects, so the common side effects are generally manageable, and the right response is to mention them to your doctor for adjustment, not to stop the medication. So common side effects like amlodipine's ankle swelling, lisinopril's dry cough, and overlowered pressure causing dizziness are generally manageable, warranting mentioning to your doctor for adjustment rather than stopping. So side effects are usually manageable by adjustment, so mention side effects rather than stopping. Let me give you the crucial safety rules because these genuinely protect you. Let me give you some genuinely important safety points that keep you safe on these medications. First, dizziness and falls. Since these medications can sometimes lower your pressure too much, especially when you stand, rise slowly from sitting or lying, and tell your doctor if you're dizzy because falls are a serious hazard, as I've discussed. Second, dehydration. If you're on water tablets or certain others and become ill with vomiting, diarrhea, or fever, or in very hot weather, you can become dehydrated and your pressure can drop. So ask your doctor whether you have a plan for such days, sometimes called sick day guidance, but never adjust medication without their instruction. Third, some of these, particularly ACE inhibitors, ARBs, and water tablets, affect your body's salts and kidney function, so your doctor monitors these with periodic blood tests, which it's important to attend. Fourth, don't add potassium supplements or salt substitutes without checking, since some of these medications affect potassium. So safety rests on rising slowly, having a plan for illness, attending your monitoring blood tests, and checking before adding potassium. So the crucial safety rules are rising slowly to avoid falls, having sick day guidance for dehydrating illness, attending monitoring blood tests, and not adding potassium without checking. So these safety rules genuinely protect you. So follow the safety rules and monitoring. Let me be very clear about the golden rule. Never stop them on your own, because this is the most important message. Now, the single most important message, which I cannot stress enough: never stop or change your blood pressure medication on your own. Here's why this matters so much. Because high blood pressure is silent, you won't feel it if your pressure climbs back up after stopping, but the raised risk of stroke and heart attack returns. Worse, stopping some blood pressure medications suddenly can cause your pressure to rebound sharply, which can be dangerous. People sometimes stop because they feel fine, and feeling fine is exactly the point. The medication is keeping you fine, or because of a side effect that could have been managed by adjustment, or because they think they no longer need it. In every case, the right path is to talk to your doctor, who can adjust, switch, or occasionally, and under supervision, reduce medication safely, never to stop on your own. So whatever your reason, never stop or change these medications yourself. Always work with your doctor. So the golden rule is to never stop or change your blood pressure medication on your own, since your pressure and its silent danger return. Sudden stopping can cause dangerous rebound, and any concern should go to your doctor for safe adjustment. So never stop these medications on your own. So always change them only with your doctor. Let me tell you what's genuinely worth mentioning to your doctor because it makes your care better. Let me tell you the things genuinely worth raising with your doctor or pharmacist about these medications, since good communication improves your care. Mention any side effects like ankle swelling, a dry cough, or dizziness, since they can often be managed by adjustment or switching. Any dizziness or falls which matter for safety. All the other medications, supplements, and remedies you take, including over-the-counter ones, since some interact, notably anti-inflammatory painkillers, which can affect blood pressure and these medications. If you're planning pregnancy, though less relevant here. and any questions or worries since understanding helps you take them well. Ask about home blood pressure monitoring and what your targets are, and as I discussed, which arm to use. So, raising side effects, falls, your full medication list, and your questions makes your care safer and better. So, it's worth mentioning side effects, dizziness or falls, your complete medication and supplement list, and your questions, since these improve and safeguard your care. So, good communication improves your medication care. So, mention side effects, falls, and your full medication list. Let me address the common worry that taking medication means failure because it discourages people. Let me address a feeling some people have that needing blood pressure medication is a personal failure or that medications are best avoided. This feeling, though understandable, isn't accurate and can discourage people from valuable treatment. High blood pressure is very common with age and is largely down to factors beyond your control, so needing medication is not a failure, it's sensible use of one of medicine's genuine successes. Lifestyle measures, a good diet lower in salt, activity, healthy weight, limited alcohol genuinely help and are worth doing and can sometimes reduce the medication needed, but they often aren't enough alone, and combining them with medication is not defeat, it's good care. So please don't see medication as failure or something to avoid. See it as valuable protection alongside the lifestyle measures that also help. So, needing blood pressure medication isn't a failure, but sensible use of valuable treatment, best combined with helpful lifestyle measures rather than avoided. So, medication is protection, not failure. So, value the medication alongside lifestyle measures. Let me paint you a quick picture of how understanding helps. Picture a man in his 70s taking Amlodipine and Lisinopril who notices his ankles swelling and develops a dry cough and, worried and disliking the pills, quietly stops taking them without telling anyone, feeling fine for a while. What he can't feel is his blood pressure climbing back up, silently raising his risk of a stroke. Now picture him understanding, knowing that the ankle swelling is a common, manageable effect of amlodipine, that the dry cough is a known effect of lisinopril that can be fixed by switching to something like Losartan, and above all, that he must never stop these on his own because the silent danger returns. He instead tells his doctor about both effects. His doctor adjusts the amlodipine and switches the lisinopril to Losartan, resolving the cough, and his blood pressure stays controlled and his risk stays low. The same man, but understanding his medications and the golden rule, got his side effects fixed and kept his protection. That contrast is exactly why understanding your medications matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that blood pressure medications like amlodipine, losartan, lisinopril, and water tablets are valuable, silently protecting against strokes, heart attacks, and more, and that the most important rule is never stopping or changing them without the doctor. You can help by encouraging a loved one to take them faithfully, to mention side effects like ankle swelling, a dry cough, or dizziness to the doctor for adjustment rather than stopping, and to attend their monitoring blood tests. Watch for dizziness and falls, since these medications can lower pressure too much and encourage rising slowly. Keep an up-to-date list of all their medications and supplements to share with the doctor and pharmacist, watching for interacting ones like anti-inflammatory painkillers. And in dehydrating illness or very hot weather, check whether they have sick day guidance without adjusting medication yourselves. Crucially, seek urgent care for the emergency features I've discussed. Helping a loved one take these medications well and safely and never stop them alone protects them. So let me draw this all together. The blood pressure medications many of you take, amlodipine, losartan, lisinopril, and water tablets, are among the most valuable life-protecting medications there are, silently reducing the serious risks of high blood pressure. They work in complementary ways. Amlodipine widens vessels. Lisinopril and losartan act on a blood pressure hormone system while protecting heart and kidneys, and water tablets clear excess fluid. Their common side effects: amlodipine's ankle swelling, lisinopril's dry cough, and over-lowered pressure causing dizziness, are generally manageable by adjustment, so they warrant mentioning, not stopping. Safety rests on rising slowly to avoid falls, having sick day guidance for dehydrating illness, attending monitoring blood tests, and not adding potassium without checking. And the golden rule, which I cannot stress enough, is never to stop or change these medications on your own, since the silent danger returns and sudden stopping can be dangerous. Any concern goes to your doctor. So take them faithfully, mention side effects and falls for adjustment, attend your monitoring, and never stop them alone. So here's what I'll leave you with, straight and clear. First, understand that blood pressure medications matter enormously because high blood pressure is a silent, serious risk for strokes, heart attacks, heart failure, and more, and these medications genuinely reduce that risk, providing real protection even though you don't feel them working. Second, know roughly how the common ones work. Amlodipine widens your blood vessels, Lisinopril, an ACE inhibitor, and Losartan, an ARB, act on a blood pressure hormone system while also protecting your heart and kidneys, and water tablets clear excess salt and fluid, often combined for complementary effect. Third, understand the common manageable side effects. Amlodipine's ankle swelling, Lisinopril's dry cough, often fixed by switching to an ARB like Losartan, and any of them sometimes lowering your pressure too much and causing dizziness, all of which warrant mentioning to your doctor for adjustment rather than stopping. Fourth, follow the crucial safety rules. Rise slowly to avoid the falls that dizziness can cause. Ask about sick day guidance for when you're ill with vomiting, diarrhea, or fever, or in very hot weather since dehydration can drop your pressure. Attend the periodic monitoring blood tests that check your salts and kidney function. Don't add potassium supplements or salt substitutes without checking, and keep your doctor and pharmacist informed of all your medications and supplements, including interacting ones like anti-inflammatory painkillers. And fifth, above all, never stop or change your blood pressure medication on your own, because your pressure and its silent danger will return. Feeling fine is the medication working rather than a reason to stop. Sudden stopping can cause dangerous rebound, and any concern, side effect, or belief that you no longer need it should always go to your doctor, who can adjust, switch, or safely supervise any change, while remembering that needing this medication isn't a failure but sensible use of one of medicine's genuine successes, best combined with helpful lifestyle measures. Your blood pressure medications quietly protect you from serious harm, so understanding them helps you take them well and safely, and the golden rule of never stopping them alone keeps that protection in place, which is well worth doing. So take care of yourself, take your medications faithfully, mention side effects and falls for adjustment, attend your monitoring, and never stop them on your own. And because these medications silently protect you and stopping them alone is dangerous, please treat any side effect, dizziness, or concern as your reason to talk to your own physician or pharmacist for safe adjustment rather than stopping. Attend your monitoring blood tests. Keep everyone informed of all your medications, and, above all, never stop or change your blood pressure medication without your doctor. This touches on medications and health worries, which can weigh on people. So if you're troubled by your medications or tempted to stop them, please know your doctor and pharmacist are there to help you take them well and safely, and any concern is worth raising with them rather than acting on alone.